As podiatrists, we aim to diagnose, manage and treat conditions or disorders of the lower limb.
Podiatrists can work in many different areas and do many different things. I can probably use my own career as a good example actually of some of the things that podiatrists can do. I've been really lucky and had quite a varied career. So I have done a lot of work with children, podiatrics, so we work with kids to keep them mobile, look at issues of growth, look at issues with pain and disorders of the foot in terms of paediatrics. We work with athletes, so I'm an MSK specialist by background, so worked with a lot of athletes and sports professionals, and we look at how mechanically things impact on the lower limb and foot function. And podiatrists will also work with a lot of older aged adults potentially and sort of general members of the public, and we look at how overall health impacts on foot and lower limb function and vice versa.
The profession deals with people of all ages, right down from young children right up to the elderly. My experience has predominantly been within the high-risk foot and prevention of limb loss from diabetes or vascular disease, as well as my interest lies more so on the sports side of things, with kind of bone, muscular injuries and trying to rehabilitate people back to their active lifestyles from that.
The MSc Podiatry pre-reg course is actually a new development that we've done here at Queen Margaret University, and it's really ideal for people who maybe already have an honours degree, whether that's in a health subject or any other subject really, and it's really, I would say, about two things. It's about allowing that opportunity for a fast track to change your career, but it's also a really good opportunity just to advance your academic career by obtaining an MSc as well. So I would say there's two real advantages of the programme as it stands. We've decided to offer the MSc Pre-Reg in Podiatry really to give people the opportunity to fast track their change of career into podiatry. Historically, if you wanted to move from another degree into podiatry, it would have been a 4-year undergraduate BSc honours. However, this now provides the opportunity to do that quicker in 2 years.
The benefits of being a professional podiatrist, there's many, but probably start with the kind of patient focus that we have. It can be a hugely rewarding career, seeing people saving limbs, seeing people getting back on their feet, that kind of thing. It's also the scope of practice that we have is very wide and very varied, so there's many aspects of podiatry that you can take an interest in and can progress towards as you develop your career in podiatry. A career in podiatry is attractive to anybody really that wants to work with people. The patient-centred nature of podiatry makes it highly rewarding in terms of you get to see patient development from injury to intervention to getting somebody back on their feet and getting them back to their normal daily life.
There are so many opportunities, it's difficult to actually capture them all, but I'll try and capture some of the main ones. So I think if you're somebody who wants to work and your passion is maybe working with children, for example, you can absolutely have the opportunity to do that and go down that route in podiatry. If you're somebody who is maybe a little bit more research driven and you want to push the boundaries of knowledge and what we know, you can move into teaching, you can move into research. Again, teaching, if you love working with others and you like to develop people, then you have that opportunity. Same in terms of management and leadership, although obviously when we think of podiatry, it is largely a clinical job we think of. There is also the opportunity to move into leadership roles, joint clinical leadership roles or purely managerial roles. And then there's obviously the things that we think about when we do think about podiatry. You'll have that opportunity to work across the age range with a whole host of different people, different walks of life, and genuinely make a real impact to those individuals.
Most people that come and study podiatry here at QMU and probably elsewhere will go straight into working clinically for the National Health Service, but it also opens up opportunities to work in private practice or own your own private practice, whether that be in a clinical setting out with your house or even from your home.
If you're looking for flexibility in a healthcare related role, podiatry can be a really good option. Whether you work in the NHS or the private sector, there are options to work part-time and work flexibly. You can structure your own hours, you can work weekends, you don't have to work weekends, not usually on call, we don't usually have to do night shift, so it's quite reasonable in terms of work schedule.
If you're looking for a podiatry course, then QMU is a great option. Here at QMU, our healthcare courses are internationally renowned, and podiatry in particular, we have decades of experience of providing a successful podiatry programme.
I think there are a lot of things special about our team and the way we work here as a department at Queen Margaret University. So myself and my colleagues were all still really connected to clinical practice. I'll use my own example. I still work in rheumatology-based podiatry, so we all have a connection to practice in that respect. We also have a strong research profile, so we have researchers in different areas spanning across both sort of quantitative and qualitative methodologies. I also think we are a very tight-knit team, and because we're a smaller team and a smaller university, it has a real advantage for us to be very student-centred. So we do tend to get to know all our students very well and vice versa, and therefore we can really build a good relationship, which I think feeds forward really well into your learning when you come here. So I think there's loads of strengths, that's just to name a few. The job prospects at the moment are excellent. We are in a situation where actually our graduates are quite often being poached even before they have graduated, just because there's so many jobs available at the moment, both in the public sector and in the private sector. So it's a really, really good time to move into this profession. It's a 2-year fast-track course which allows you to change your career direction and will ultimately allow you to develop yourself personally and professionally and graduate into a career in podiatry which is both flexible and really, really rewarding. And at the moment, the job opportunities for the profession are really excellent.